Good day. I am Professor Teke Apalata, a specialist in clinical microbiology. And today we are going to review a couple of chest X-ray from COVID-19 patient who developed pneumonia. And so that we can see what are the commonest chest X-ray patterns that we can that we often see in a patient with COVID-19. So let me just share my screen with you. And so I say that we will look at radiologic diagnosis of patient with COVID-19 pneumonia. So I try to look at one of the article that was published last year in BMC Pulmonary Medicine. And this article is titled Chest X-ray Findings and the Temporal Lung Changes in Patients with COVID-19 Pneumonia. In this study, the authors enrolled 88 patients, and they have done 190 chest X-ray on those 88 patients. So they had baseline chest X-ray done, and they have also done follow-up chest X-ray. Now, the most important thing from this study is that during the first week of infection, 1 out of every 4 patients had a normal chest X-ray. So 25% of those patients had a normal chest X-ray, and 55% of them develop what we call ground glass opacities on their chest X-ray, and 20% had what we call consolidation. Now, in the second week of infection, the vast majority of patients who had the normal chest X-ray on their first week now developed abnormal results. So in that they were 25%. Now in the second week, they were only 9% with a normal chest X-ray result. Then 70% of the patient had ground glass opacities as a pattern on their chest X-ray. Then 30% of those patients developed consolidation. But interestingly enough, there was a third pattern that added that what we call reticulation, okay? Then on the third week, there was no single patient with a normal chest X-ray. So 80% of patients develop ground glass opacities, 10% with consolidation, and 10% with reticulation. Then on the fourth week, then we had 33% of patients who recovered had a normal chest X-ray, then 50% still with ground glass opacities, and the rest with consolidation. Now, the other study published in 2021 in Radiologic, titled Radiologic Diagnosis of Patients with COVID-19. In this study, the author's findings almost support, the study that I shared with you. So the most common radiologic findings in COVID-19, according to the authors, are airspace opacities that include consolidations and or ground glass opacities. And interestingly enough, these authors found that those lesions are bilateral, they are mostly peripheral, and located primarily in the lower field of the lungs. Then there is another big study that was published by the Egyptian Journal of Radiology and the Nuclear Medicine. This study enrolled 350 proven COVID-19 patients. Okay, then 37% of those patients had a normal baseline chest X-ray, with 63% developed abnormal chest X-ray at a baseline, of which 81% had consolidation, followed by reticulation in almost 40%, and the rest of the patient had ground glass opacities as a pattern on their chest X-ray. Now, what am I saying? I'm saying in conclusion that in COVID-19 patients who develop pneumonia, we have three major patterns that we can see on their chest X-ray. We can see ground glass opacities, we can see consolidation, and we can see reticulation in the lung. So now let's look at all those patterns. The first one is what we call ground glass opacity. Ground glass opacity simply refers to hazy gray areas that you can see on a chest X-ray of the lung, indicating that there is an increase in the density inside the lung. So this is how a normal chest X-ray look like, where you have everything is black. You see, it means that there is air, in the air spaces. That's what you can see. You can see the both chests, there is no obstruction. There is a very good presence of air in the all air spaces. But then when you see a gray color instead of black, you see a gray color, it means that there is a density, an increase in the density. And this means that the air spaces are partially filled with something. And that something can be fluid, or it can be pus, like in this case of pneumonia caused by COVID-19, or it can be fluid, it can be pus, it can be cells in patients who have cancer in the lungs, So that make the color, instead of being black, to become a bit of gray. And that's what we call that hazy gray area that you can see is what we call ground glass opacities. Now, because the air spaces are only partially filled with the lung, so the density starts increasing, and they give you that pattern of ground glass opacity that you can see. Now, this is what we can see on those chest X-rays from these three patients. We have 4 patterns that we can see here, 4 chest X-ray. The first patient here, patient A, is a 29-year-old female patient who presented with cough and fever. And the chest X-ray, as you can see, shows bilateral, so both sides, bilateral, upper zonal ground glass opacities. You see here and here. You can see gray areas, hazy gray areas here and there. So it's both sides of the lung. Then B and C, this is the same patient, and B is the baseline chest X-ray, that's in a 74-year-old male patient who came with dyspnea and fever. So the chest X-ray shows bilateral lower zonal ground opacities. So you can see here, this is a gray area here, a gray area there. The rest of the lung is black, but you see a gray area here and there. And here it just gets worse during follow-up. You can see that it's increasing. It was lower, then it's progressing toward the mid-zone of the lung. Then the last patient is a 54-year-old male with shortness of breath and cough. And the X-ray here show right lower zonal and left mid and lower zonal ground glass opacity that you can see here. Okay, now the second commonest pattern that you can see in COVID-19 patient with pneumonia is what we call consolidation. Okay, consolidation simply is when both small airways and alveoli in the lung are now filled, are filled with dense materials. They are filled with dense materials. So that can be fluid, like in the case of pulmonary edema, it can be pus. In case of pneumonia, it can be blood in case of pulmonary hemorrhage, or it can be cells in case of cancer. Now here we are talking in the case of infection, it can be fluid as a result of inflammatory response or pus, that we can see in these patients. So when the lung, when the airways and the alveoli are now filled with the fluid, they become consolidated. So that's what we call consolidation. When they are simply partially filled, like in this case, when they are partially filled, we speak about ground glass opacities. But in the case of consolidation, the air is replaced by the fluid or any dense material. So they all look similar in clinical information, but they all look on chest X-ray, they look similar, but you can then use clinical information. Like for these cases, most of all those patients had proven COVID-19 infection. But something else is very important that you can see in patients with consolidation is what we call the air bronchogram. The air bronchogram simply means if this is an area of lung, if an area of the lung is consolidated, it becomes dense and white. Now, if the larger airways are spared, they are of relatively low density. So you will see that the area that becomes consolidated, that will be dense and white, then around it you see the larger airways that are spared that look of low density. That's what we call the air bronchogram. So this phenomenon is known as the air bronchogram, and it is a characteristic sign of consolidation. Consolidation can be lobar, it can be diffuse, or it can be multifocal with air bronchogram. Okay, so let's look at these images. In these images, you can see here this a 28-year-old patient, male patient, who had a positive COVID-19 infection, and here he developed what we call the upper lobar pneumonia. So you can see here, you can see area of consolidation here. It takes all these lobe, this upper lobar pneumonia, okay, in this patient. And here you can see bilateral areas of consolidation, that is faint bilateral infiltrate in lower field with a minimal pleural effusion that you can see it very well here. A bit of fluid, in the pleural cavity, with very minimal pleural effusion that you can see in this patient. And here we have the patient A is a 72-year-old male patient, with the X-ray showing bilateral peripheral mild and lower zonal air space consolidation. So you can see here, mild and lower, bilaterally, you can see consolidation here and there. And you can also see in this patient, you can see consolidation. Those are peripheral consolidation that, you can be able to see, that are peripheral consolidation. It's typical clinical radiological presentation in a patient with a COVID-19 pneumonia. And here you can see those consolidation, those are not peripheral, like this one in this 39-year-old female patient with chest X-ray showing right, here you can see right perihilar airspace consolidation, opacity, okay? And in the left here, you can also see it's a lower zonal airspace consolidation. And here we have a 44-year-old female patient showing left, in the left perihilar airspace consolidation opacity. And we can also see here and there in a 35-year-old male patient showing, airspace consolidation opacities. And in this series of chest X-ray, you can see in this patient, we have bilateral mid and lower zonal airspace consolidation opacities. So it's mid and lower opacities consolidation. And here we can see perihilar left opacities. And in this patient here, we can see a left mid-zonal, neither peripheral nor perihilar airspace consolidation opacity is seen here. Okay. Then the third commonest pattern in a patient with COVID-19 pneumonia, it's what we call reticulation or a reticular interstitial pattern that we can see in the lung. So reticulation in lung results from thickening of the interlobular or intralobular septa and appears as several linear opacities that come together to form what we call a mesh. And the common causes when you see reticulation, it can be interstitial pneumonia, like in the case of a COVID-19 patient, they develop interstitial pneumonia, or you can also find reticulation in a patient with fibrosis or hypersensitivity pneumonitis or diseases like sarcoidosis or asbestosis. They also develop reticulation in the lung. So this is what we can see here in image A. Here we can see this is a 48-year-old male. This is also a 48 years. This is a 46, and this one is a 61-year-old male patient. They all showed bilateral, if you can see, bilateral diffuse reticular interstitial lung thickening with airspace consolidation opacities that you can see both sides here. You can see here and there, So they see reticulation with consolidation in their lung bilaterally. And here you can also see areas of reticulation and consolidation that comes together. And most of those lesions are bilateral, both side of the lung that you can be able to see. Now, I will leave these images for you. Pause your videos, few seconds, think about this and write your comments, your interpretation about those 6 images that I will leave with you. So, what am I saying? I'm saying that we need to think of those 3 commonest images that radiological images on chest X-ray when we are looking at result from a patient with COVID COVID-19 who presented with pneumonia. Thank you and see you next time.